The cold autumn night wrapped around the city like a thick blanket as a worried father burst through the doors of Corner Street Pharmacy. His hands trembled as he clutched the prescription paper, his breath coming in short bursts from running 3 blocks after his car broke down. His young son was fighting for his life at home, burning up with pneumonia that had gotten worse over the past few days. The fluorescent lights cast harsh shadows across the nearly empty pharmacy as he approached the counter. Behind it stood a middle-aged pharmacist with thin-rimmed glasses and a pressed white coat, who barely looked up from his computer screen. The father's voice shook slightly as he spoke. "Please, I need this filled immediately. My son's fever is getting worse." The pharmacist took the prescription paper between his fingers as if it might bite him. His eyes narrowed as he studied it, then looked up at the father with unconcealed suspicion. The clock on the wall ticked loudly in the silence. "This seems irregular," the pharmacist said finally, his tone cold and dismissive. "I can't verify this prescription at this hour." "But I have all the documentation right here," the father protested, pulling out his ID and insurance cards with shaking hands. "Look, here's my son's medical history, his insurance card, everything. Please, he needs this medicine." The pharmacist's lips thinned into a hard line. "I said no. Come back tomorrow during regular business hours when we can properly verify this." The father's heart sank as he realized what was happening. He'd seen that look before. The barely concealed prejudice, the automatic assumption of wrongdoing. But this time, it wasn't just about him. His son's life hung in the balance. Pulling out his phone, he called his son's doctor at the hospital, putting the call on speaker so the pharmacist could hear. A female doctor's voice came through clearly, confirming the prescription's legitimacy and the urgent need for the medication. Yet the pharmacist remained unmoved, his arms crossed over his chest. Other customers in the store had stopped to watch the scene unfold. A young woman was recording discreetly with her phone, her face a mask of concern and anger. An elderly man shook his head sadly, muttering under his breath about how some things never change. The father felt tears of frustration burning in his eyes as he realized he would have to leave empty-handed. His son's ragged breathing echoed in his memory as he gathered his papers with trembling hands. As he turned to leave, another customer stepped forward, their own phone recording the incident. The truth of what happened that night wouldn't stay hidden in the shadows of that fluorescent-lit pharmacy. Little did anyone know, this was just the beginning of a story that would shake their community to its core. What started as one father's desperate attempt to get medicine for his sick child would soon spark a movement that would force people to confront uncomfortable truths about healthcare inequality and discrimination in their own backyard. The viral video of that night at the pharmacy spread like wildfire across social media platforms. A caring pharmacist from another branch, who lived 20 minutes away, watched the footage during her lunch break. Her hands shook with anger as she replayed the video, watching her colleague's cold dismissal of a desperate father. She knew something wasn't right. After her shift, she stayed late at work, digging through the system's records. Hour after hour, she uncovered a disturbing pattern. The same pharmacist had turned away several other families of color, always finding excuses about suspicious prescriptions or verification issues. The timestamps showed these rejections happened mostly during night shifts when there was less oversight. Back at home, the sick child's condition had taken a frightening turn. His fever spiked dangerously high, and his breathing became more labored. The father, exhausted and worried sick, had to call an ambulance. The emergency room staff were shocked when they heard about the denied prescription. One nurse shook her head in disbelief, saying she'd never seen such a clear-cut prescription rejected before. Local news stations picked up the story. A reporter with kind eyes interviewed the father in the hospital waiting room. He spoke softly, his voice breaking as he described watching his son struggle to breathe. "I just wanted to help my boy," he said, wiping away tears. "No parent should have to go through this." The pharmacy's corporate office was flooded with calls and emails. People shared their own stories of discrimination, each one adding to the growing outrage. The pharmacy chain's regional manager called an emergency meeting. Security footage was reviewed, witnesses were interviewed, and the evidence became impossible to ignore. Meanwhile, the community rallied around the family. A local church group organized a prayer vigil outside the hospital. Neighbors brought home-cooked meals to the father who hadn't left his son's bedside. A retired nurse who lived nearby offered to help coordinate with the medical team. The story touched something deep in people's hearts. It wasn't just about one prescription or one pharmacist. It was about human dignity, about a father's love for his child, and about the basic right to healthcare without discrimination. Social media comments poured in from across the country, with many sharing similar experiences they kept quiet about for years. A group of local medical professionals came together, volunteering their time to ensure nothing like this would happen again. They started drafting guidelines for after-hours prescription verification, determined to create positive change from this painful situation. In the hospital room, monitors beeped steadily as the young boy fought his illness. His father sat beside him, holding his small hand, praying for recovery while the community outside continued to grow stronger, united in their demand for change. The hospital waiting room buzzed with tension as the pharmacy chain's internal investigation unfolded. Witnesses came forward one by one, sharing stories that painted a troubling picture. The pharmacist who had denied the prescription wasn't just having one bad night. This was a pattern stretching back months. Staff members spoke about watching him scrutinize certain customers more than others, making excuses about computer systems being down, or claiming prescriptions needed extra verification that mysteriously never got completed. A young pharmacy technician admitted she'd seen him throw away valid prescriptions after some customers left, thinking no one was watching. Outside the pharmacy, the protests grew larger each day. Mothers with strollers stood next to businessmen in suits, all holding signs demanding accountability. Local religious leaders joined hands with community organizers, their unified voice growing stronger. The evening news showed aerial footage of the crowds, their numbers swelling to fill the entire block. The investigation revealed more than just individual bias. It exposed systemic failures. Security cameras had captured dozens of incidents, each one adding to the weight of evidence. The pharmacy's corporate office couldn't ignore the truth any longer. They placed the pharmacist on immediate suspension, but for many, this wasn't enough. The sick child's condition reached a critical point. His fever refused to break, and doctors worked tirelessly to stabilize him. The father barely slept, his eyes red from exhaustion and worry. Hospital staff quietly brought him extra blankets and coffee, their small gestures of kindness providing comfort during the darkest hours. Community support transformed into action. A retired judge offered pro bono legal support. Medical students organized workshops about patient rights. Local businesses put up posters showing solidarity. A neighborhood watch group started accompanying people to pharmacies at night, ensuring no one else would face discrimination alone. The story caught national attention. Civil rights organizations began investigating similar cases across the country. Healthcare advocacy groups used this incident to push for policy changes. What started in one small pharmacy was becoming a catalyst for nationwide reform. In the middle of this growing movement, a night nurse noticed something remarkable. The child's fever finally began to drop. His breathing grew stronger, each small improvement feeling like a victory. His father wept with relief, knowing that while the fight for justice would continue, his son was starting to heal. This wasn't just about one prescription anymore. It had become about a community standing up for what's right, about people coming together to say enough is enough. The ripples of change were spreading, touching lives far beyond that one fateful night at the pharmacy. The viral story of what happened at the pharmacy that night reached an influential healthcare advocate who lived 2 states away. She watched the footage of the desperate father being turned away and immediately booked a flight to meet with local community leaders. Her arrival energized the growing movement. Speaking at a community center packed with concerned citizens, she shared statistics about healthcare discrimination that made people gasp. But more importantly, she brought solutions, concrete steps for change that had worked in other cities. The pharmacy chain's corporate offices felt the pressure mounting. Their phone lines were flooded with calls from major news networks. Social media hashtags about the incident trended nationally. Shareholders started asking uncomfortable questions about liability and reputation damage. Inside the hospital, there was a breakthrough in the child's treatment. A new combination of medications finally started working, and his breathing improved significantly. The father, who hadn't left the hospital for days, broke down in tears when the doctor shared the good news. The nurses who had been caring for them celebrated quietly, knowing how close they'd come to losing him. The caring pharmacist who had discovered the pattern of discrimination testified at the internal investigation. She brought forward evidence that couldn't be ignored: dates, times, and detailed records of similar incidents. Her voice shook but remained strong as she described watching her profession's ethics being violated repeatedly. A local tech expert volunteered to analyze the pharmacy's computer records. They discovered that the problematic pharmacist had been marking certain prescriptions as suspicious at a rate far higher than any other staff member. The data showed an undeniable pattern of bias. The story started appearing in medical journals and ethics publications. Healthcare professionals across the country began examining their own biases and practices. Medical schools added new training modules about discrimination in healthcare delivery. Community members organized a fund to help cover the child's medical bills. What started as a small online fundraiser exploded when a popular social media influencer shared it with their millions of followers. The donations poured in, accompanied by thousands of supportive messages. The incident became a teaching moment, but not in the way anyone expected. It showed how one person's prejudice could threaten a life, but also how a community could come together to demand change. People realized that staying silent wasn't an option anymore, not when lives were at stake. The pharmacy chain's board of directors called an emergency meeting on a rainy Tuesday morning. The evidence spread across their conference table painted a damning picture. Surveillance footage, computer records, and witness statements proved what they feared. This wasn't an isolated incident. Down at the hospital, the young patient's recovery continued steadily. His breathing grew stronger each day, though the dark circles under his father's eyes showed the toll of countless sleepless nights. The nurses had grown protective of them both, making sure the father ate and rested when possible. The caring pharmacist who exposed the discrimination received an unexpected call. A national healthcare advocacy group wanted her to help develop new training programs. Her documentation of the incidents would become a case study in how to identify and prevent healthcare discrimination. Local medical students started a unique initiative. They began offering free healthcare advocacy services, accompanying people to pharmacies and helping them understand their rights. Their presence made a difference. Reports of discriminatory treatment dropped significantly at pharmacies where they regularly visited. The community's support took creative forms. A local artist painted a mural outside the hospital, showing hands of different colors reaching out to help each other. Children from nearby schools made get-well cards for the sick child. A food truck owner parked outside the hospital each day, ensuring the father had warm meals. Media coverage expanded beyond just reporting the incident. Investigative journalists uncovered similar cases across the state. Their research revealed a troubling pattern of healthcare discrimination that had gone unchallenged for years. Each new story added momentum to the growing movement for change. The pharmacy chain faced mounting pressure to take decisive action. Their stock prices dipped as investors worried about potential lawsuits. Corporate leadership realized Band-Aid solutions wouldn't be enough. They needed systemic change. Meanwhile, hospital staff noticed something remarkable. Other families started speaking up about their experiences with healthcare discrimination. The father's courage in standing up that night had given others the strength to share their stories. Each testimony added another piece to the puzzle of inequality in healthcare. The incident sparked conversations in unexpected places. Teachers discussed it in classrooms. Religious leaders addressed it in sermons. Even local government officials began examining their policies around healthcare access and discrimination. The young patient's condition had finally stabilized, but the story was far from over. His hospital room became an unexpected center of activity as community leaders and healthcare advocates gathered to plan their next steps. The father, though exhausted, knew his son's experience could help prevent similar incidents. A state senator visited the hospital after hearing about the case. She listened intently as the father shared every detail of that frightening night at the pharmacy. Her hands clenched when he described watching his son struggle to breathe while being denied vital medicine. By the end of their conversation, she was already drafting new legislation. The pharmacy chain's internal investigation reached its peak. Hours of security footage revealed disturbing patterns. The discriminatory pharmacist hadn't just targeted one family, he turned away dozens of minority customers over several months. Each rejection followed the same pattern: excessive questioning, claims of suspicious prescriptions, and delayed verification that never happened. News crews set up outside the pharmacy daily. They interviewed former customers who shared similar experiences. One elderly woman broke down crying as she described being turned away 3 times while trying to get her heart medication. A young mother told how she'd had to drive to 5 different pharmacies late at night to get her child's asthma medicine. The hospital staff organized a support group for families who'd faced healthcare discrimination. Every week, more people came forward with their stories. The meetings became a place of healing, where people found strength in sharing their experiences and supporting each other. Local doctors started offering free consultations to review cases of possible discrimination. Their findings were shocking. They discovered dozens of instances where delayed or denied medication had led to serious health complications. The evidence they gathered strengthened the push for reform. A prominent civil rights lawyer offered to represent affected families pro bono. His office was flooded with calls as more people came forward. Each new case added weight to the argument for systematic change in how pharmacies operate, especially during night shifts. The young boy's recovery became a symbol of hope. Despite the initial setback caused by the delayed medication, his strength grew daily. Hospital staff celebrated each small victory: his first steps down the hallway, his first full meal, his first genuine smile in weeks. The pharmacy chain finally made their decision. After weeks of investigation and mounting public pressure, they announced the discriminatory pharmacist's immediate termination. But this was just the beginning of their response to the crisis. The corporate office unveiled a comprehensive anti-discrimination policy. Every pharmacy in their network would now have 24-hour verification systems. Security cameras would record all interactions. Most importantly, they implemented a new oversight system where multiple pharmacists had to review any prescription denials. The young patient continued to show remarkable improvement. His fever finally broke completely, and doctors started discussing discharge plans. The father, who hadn't left his son's side for weeks, could finally see light at the end of this dark tunnel. The state senator who'd visited earlier introduced new legislation dubbed the Right to Care Act. It proposed strict penalties for healthcare discrimination and required all pharmacies to maintain detailed records of prescription denials. The bill gained bipartisan support as stories of discrimination continued to surface. Local medical schools took notice. They revised their curricula to include mandatory training about healthcare discrimination. Students now had to complete practical exercises dealing with bias and prejudice before they could graduate. The caring pharmacist who exposed the discrimination was promoted to head a new compliance department. Her first task was developing a training program that would be implemented nationwide. She worked with civil rights experts to create guidelines that would prevent similar incidents. Community support grew stronger. Local businesses started a fund to help families affected by healthcare discrimination. The hospital established a 24-hour patient advocacy hotline. Social workers volunteered their time to help people navigate the healthcare system. As news spread, similar initiatives started popping up in other cities. Healthcare advocacy groups use this case as a model for change. What started as one family's nightmare was transforming into a nationwide movement for healthcare equality. The father received hundreds of supportive letters from across the country. People shared their own stories and thanked him for standing up. His courage in speaking out had given others the strength to demand better treatment. The young boy's condition reached a turning point. After weeks of intensive care, he was finally strong enough to go home. The hospital staff gathered to celebrate his discharge, many of them fighting back tears. They'd watched this family endure so much, and now they were witnessing their triumph. The community's crowdfunding campaign exceeded all expectations. Donations poured in from across the country, enough to cover not just the medical bills, but also to establish a foundation helping other families facing healthcare discrimination. The father was overwhelmed by the generosity. Knowing his son's struggle would help countless others. The pharmacy chain's new training program rolled out nationwide. Every employee, from senior pharmacists to part-time clerks, underwent intensive bias awareness training. The caring pharmacist who exposed the discrimination led many sessions herself, sharing the story as a powerful example of what not to do. Medical professionals from other states started visiting to study the changes being implemented. They were particularly interested in the new verification system that made it impossible for a single pharmacist to deny prescriptions without oversight. The system was already being adopted by other pharmacy chains. Local schools invited the father to speak about his experience. He shared his story with students, teaching them about standing up for what's right. The children listened intently, asking thoughtful questions about fairness and justice. Many wrote letters afterward, promising to speak up when they saw discrimination. The state senator's Right to Care Act passed with overwhelming support. It became a model for similar legislation in other states. Healthcare advocacy groups celebrated it as a crucial step toward ending discrimination in medical care. The hospital implemented new protocols inspired by this case. They established a rapid response team for prescription denials and created partnerships with 24-hour pharmacies committed to fair treatment. The changes were already making a difference for other families in crisis. The father noticed something changing in his community. People who'd been afraid to speak up about their experiences with discrimination were finding their voices. Support groups formed, sharing stories and strategies for advocating for better care. What started as one family's crisis had sparked a movement for change. 1 year had passed since that fateful night at the pharmacy. The young boy, now fully recovered, played in the backyard of their home, his laughter a testament to his resilience. His father watched from the porch, reflecting on how their painful experience had transformed into a force for positive change. The pharmacy chain had completely overhauled its practices. Their new anti-discrimination policies became the industry standard, adopted by healthcare providers nationwide. The caring pharmacist who exposed the discrimination now traveled the country, training others and sharing her expertise in preventing healthcare bias. The foundation created from the crowdfunding campaign had helped hundreds of families facing similar challenges. They provided not just financial support, but also legal advocacy and emotional guidance. Each success story added to their determination to keep fighting for change. The state's Right to Care Act inspired similar legislation across the country. 20 other states had adopted versions of the law, creating a growing network of protection against healthcare discrimination. Healthcare advocacy groups cited it as a turning point in the fight for equal medical access. The father found his calling as a healthcare advocate. He spoke at medical conferences, sharing his family's story to help future healthcare providers understand the real impact of their actions. His words touched hearts and changed minds, one audience at a time. Local schools added the case study to their curriculum, teaching children about equality and standing up for what's right. The young boy sometimes joined his father at these presentations, his presence a powerful reminder of why this fight mattered. The community remained vigilant. The support groups continued to grow, creating a strong network of advocates ready to help anyone facing discrimination. What started as one family's crisis had become a movement, changing lives far beyond their small town. Medical professionals noticed a significant drop in reported cases of discrimination. The new systems and oversight had created real accountability. More importantly, attitudes were changing as people recognized the vital importance of fair and equal healthcare access. As the father tucked his son into bed that night, he felt grateful. Their struggle had been difficult, but it had sparked changes that would help countless others. Sometimes, he reflected, the darkest moments could lead to the brightest transformations.